Hi there, my name is Dr. Katie Saint, and this training video is on social skills. So I am going to go ahead and share my screen and we will get started. So social skills is super important to target because it impacts everything. Thankfully, social skills interventions are proven to work. There's a lot of research that has gone into this over the years where they've really investigated, are we wasting our time with these interventions or do they actually have an impact? And the good news is that social skills interventions does improve social skills. It also helps set people up for success and it reduces symptoms of depression. So the impact is really valuable as far as life outcomes, happiness, success, all of that kind of stuff. Social skills gets integrated into all parts of life. So it's a really important area to target. So, one of the areas that is common to be a struggle for people with an autism diagnosis is social reciprocity. So, that's the back and forth in relationships. This tends to be a struggle for the clients that we work with. Understanding what is needed in a social back and forth, understanding what would be perceived as unexpected or unusual, a lot of times those social cues are missed, and so they need to be formally taught. Perhaps you've heard of the program Expected and Unexpected Behaviors, or there's social thinker programs or Superflex. We have a lot of different programs that help break down these different social interactions that break that back and forth connection that happens between two people. So sometimes the clients that we work with struggle with sharing interests or sharing their feelings or their affect. They don't show what someone is wanting from them or expecting, and so that can cause a barrier. So when you come home really excited with tons of news, and then someone's like, cool, and that's all they get from you, you don't feel connection then. And so sometimes people need to be trained. Hey, if somebody's excited, if something good happened to them, show excitement, show that you're happy for them. They might be feeling that internally, they just didn't express it. So some of that needs to be taught formally. And so there's a lot of different ways we can break this down and we can navigate this and help understand what the difference is, what the social rules are, things like that. Another area that tends to be a struggle is lack of social initiation. So there's a lot of different reasons that people on the spectrum don't always initiate social interactions. Sometimes they don't know what to do. Maybe in the past it has not been reinforced. And so if we can train what would be successful and what would help them access reinforcement and have it go well, this will help them want to initiate. This will help them feel more confident. And so just going through those trials and learning what to do can really help in that area. And so the next one is lack of responding to others who are initiating social contact. So a lot of people on the spectrum have just didn't respond in response to social interactions or didn't know they were supposed to. They didn't have anything to say, and it doesn't even have to be people with an autism diagnosis. Plenty of people who don't have that diagnosis struggle with this too. And so just learning these basic rules and learning how to respond, when to respond, all of those things can really help with creating connection and social interaction. So, one thing I want to make clear is that we're not teaching people to be fake. We're not teaching people to hide their personality. That is not at all what we're teaching when we're teaching social skills. What we're teaching with social skills is how to connect. how to be authentic, and how to navigate situations without really offending people or communicating something that you don't intend to communicate. And so that's where a lot of breakdowns happen. Their body language or what they communicated verbally didn't communicate what they were actually thinking or feeling. And because of that, relationships were harmed or lost. And so, if we can help give a person tools and strategies to prevent unnecessary conflict or unnecessary relationship breakdown, they're going to be so much more successful. So, communication is one of the core deficits in the autism diagnosis, but communication struggles is not limited to just people with autism. Think about how many adults struggle with communication. Think about your own parents. Were they a healthy model for you? Or do you feel like as an adult, you've had to figure out healthier communication yourself? So, this is something that we can all improve on, and it's the core of relationships. But when we're looking at an autism diagnosis, sometimes body language is an issue, sometimes displaying the correct facial expression or just understanding other people's social cues can be an issue. I've had many clients tell me, I don't even look at the person I'm talking to. I have no idea what their facial expressions are or their body language is. But if you're not reading that as you interact with a person, you might miss something important. Maybe you said something offensive and you didn't notice that they were offended. And so now you've gone on for a while and you don't even know it. Versus if you were paying attention, you could have addressed that and corrected it so relationship damage didn't happen. So that is definitely something we work on and target, having facial expression and body language that matches the context, and then responding to other people's. So this next one is eye contact. For people on the spectrum, sometimes eye contact is really uncomfortable and unpleasant. And so figuring out what to do with eye contact is important because eye contact can communicate interest or disinterest. And so, if your child is somebody who is really uncomfortable with eye contact, learning to look at somebody's mouth or their forehead or, just past their ear or something like that sometimes can help so that people know that they're talking to them or that they're interested, things like that, or even just looking at the person and then looking away, rather than maintaining that eye contact for long periods of time. There's different ways to navigate the eye contact situation so that your child can feel comfortable, but the person they're in a conversation with knows they're interested, knows that they are talking to them, and all of that. Um, the next one is understanding jokes and inferences. This can be a struggle for a lot of our kids. Understanding direct communication makes sense to them, but interpreting sarcasm, jokes, inferences, all of that can be hard. But thankfully, this can be taught, this can be broken down. And as long as you're talking through it, they can learn as you go. So, talk about this in your home. Next is challenges in verbal communication. So, a lot of times with an autism diagnosis, knowing what to say, when to say it, how to say it can be challenging. So, working with your child on communicating, don't talk for them, help them figure out their words, help them figure out what they need to say in that moment to help get their needs met. If you always talk for them, when you're not there, they don't have the words, they don't have the skills. So you want to give your child those skills so that they can be successful even if you're not around. So, relationships tend to be a struggle for people on the spectrum. Not always, but if social skills aren't worked on, they definitely can be. So, the reason for that is because some people on the spectrum avoid relationships. They feel like they can't be successful. So they're like, why try? Which is super sad because they can be successful and they can have deep and meaningful relationships. Um, there's a high degree of rejection that they've maybe experienced because of some of the social interactions they've had. They might have issues in work and school because of their social interactions. And they might struggle to maintain relationships because of misinterpretations, miscommunications, different things like that. So, we want to target how to maintain relationships, how to make friends, and how to keep them. We want to really be intentional about providing opportunities to work on this so that your child can have complete success with having long-term meaningful relationships. So, when your kids are young, in order to help them be successful socially, we want to target leisure and play skills. Some of our kiddos love to stim, and stimming is okay to do. But if that's the only skill you have, it's going to be hard to play with other kids. So we want to expand their interests. We want to expand their leisure activities so that they have activities that they can do with other peers that they also enjoy. So we want to expose them to different activities. We want to make those activities really fun and pleasant. So don't just force your child to play with some toy they don't want to play with. That would be so unpleasant. You want to be silly, you want to be fun and interactive, and make it a really positive experience for them so that they're pairing those leisure activities with fun rather than something aversive. We want to target rigid behavior as well. It is common for people on the spectrum to have really rigid behaviors that sometimes prevent them from interacting with others socially. And so, if your child refuses to leave the home or refuses, whatever their rules are, that can limit them. So, we want to work on that flexibility. We don't want to give into those routines all the time, because what will happen if we give in to rigid behavior is their world will get smaller and smaller and smaller. And that doesn't lead to them being happier. Being in their comfort zone in this really, really rigid world actually produces a ton of anxiety. So we want to help them face those things. We want to help them see that they can cope with that, and actually they can live a really happy and fulfilling life with a little more flexibility than they originally thought they had. So, joint attention is something we want to teach, where we're teaching them to play with another person and have that joint attention together. So, a lot of times our kiddos are good at what we call parallel play. So, that's like when two people are building towers with blocks. They're building two separate towers, it's completely separate. They're in the same area, they're doing the same activity, but they're not interacting. They're not connecting, they're not bonding, they're just doing the same thing together. So we want to teach that interaction so there's more connection. We want to teach different ways that they can interact with a peer or another person, so they can experience connection in that way and build friendships. Next is communication. We want to target communication in all areas of life. So once your child makes a sound or says a word or whatever the case may be, make that the standard. Once you know they're capable of that level of communication, don't accept lower. Because if you make that the standard, they will then communicate that on a regular basis, and they will be able to communicate with more people. If you talk for them or if you do things for them because you know what their grunts mean, you are limiting their communication. They need to practice communication in order for it to grow. And sometimes that means you're waiting them out or you're prompting them. I would be happy to give you that cookie, but I need you to ask for it. So provide those opportunities as much as possible and don't talk for them. Next, pairing reinforcement with peers. Sometimes kids pair peers with punishment because their experience with peers is they have to share their toys, people take their stuff. Like it's just not as fun. They steal attention from adults. So try to set up scenarios where peers are fun, where peers have help good things happen. Set them up for success so that they can see that peers are actually super fun and a good thing to have in their life. Next is bringing your child out into the community. So this is a valuable one. A lot of people did this less during COVID, and we really saw the impact. We had kids with a lot bigger fears. We had kids with a ton of anxiety leaving their house and interacting with other people. So just that exposure to leaving the house, going to different places, being exposed to different environments is really valuable for your child and is going to help them be more comfortable. It's going to help them be more confident. It will reduce their anxiety and help them be more successful socially. So, next, what to target when your kids are getting older. So, when you have elementary age students or even kids who are preschool that age, we really want to start working on setting up those play dates and those group situations so we can practice those relationships. We really want to build them. We really want to find peers that they can connect with and have long-term friendships. So if you have cousins or friends, things like that, schedule play dates so that we can work on these social skills and practice them. And then during those play dates, monitor so that if your child is doing something to push peers away or to hurt friendships, that you can give that feedback to help them correct it, but also so that you can praise them and reinforce them for when they're interacting in a way that really helps build friendships. So we want to also avoid reinforcing things that are punished by peers. So a lot of kids who have special interests will go on and on and on and on and on and talk for an hour about what it is they care about, which we love them. And so we want to listen and we want to encourage this. And we feel rude being like, okay, you've talked for 30 minutes straight. That's enough. But if they're doing this to peers, it's really going to hurt relationships and it's risking getting them rejected. So when it comes to this with your child, set limits on it. Explain to them that you love them, you care about them, you want to hear about their interests, but they have to follow some rules about expressing it. And so this is going to help set them up for success with other peers. So next, look for opportunities to reinforce and give feedback in the home for social interactions. So just look for everyday moments to give that feedback. And again, don't reinforce things that would not be reinforced by peers. All right. So to conclude, social skills definitely can be improved if we target them, if we work on it. And if we do work on these social skills, it's going to be one of the biggest things that will help your child be more successful and happier later in life. So definitely target these skills. If you need more help learning how to target these skills, reach out to your therapy team and they can definitely help give you more strategies to specifically work on your environment. All right, guys, thanks so much for listening and good luck working on those social skills.